Greetings, everyone, and thank you for joining us today. My name is Hugh Bailey. I support the outreach efforts for the Work Ed Health program, and I'll be your host this morning. This information session will explain and illustrate how you can assist the employers that you trained gain access to valuable technical assistance leading to successful and comprehensive worksite wellness programs. Additionally, you will learn what resources Work Ed Health can offer to you and your communities. So we're looking forward to a very exciting 30 minutes this morning. Before we begin, a few important notes. This event is being recorded, and the recording is available upon request to the Work Ed Health Customer Service Center. You will receive that contact information later in our program. Audio for this event is provided via broadcast. If you need technical assistance or need to ask a question about today's topic, please use the Q&A, the question and answer panel on the right side of your screen. Although we will have a Q&A segment after the interview, you may submit a question at any time. Please note that your typed questions are limited to 256 characters. Lastly, this webinar is provided for informational purposes only, and participants, you need to make sure you consult independent professionals to discuss how specific matters that we related to your business or organization and how that will impact you. So we want to make sure you do that. Now, without additional delay, I would like to introduce today's special guest, Ms. Nikki McCoy. Nikki is the Director of Technical Assistance for the Work Ed Health program with Ashland Management Group. Nikki is a North Carolina native and brings 17 years of public health research experience to the Work Ed Health program. Welcome, Nikki, and thank you for being here today.
Good morning, Hugh. It's great to be on the line with you.
Well, Nikki, we have a lot of information that we want to try to convey this morning, and a lot of people who are interested in hearing what you have to say today. So why don't we jump right in. Many of the participants on the line today are familiar with the Work Ed Health program, but they may not be familiar with technical assistance. Can you describe a little bit about Work Ed Health technical assistance?
Sure, Hugh. And, you know, many of the folks on the line, I think all the folks on the line are our former T3 participants. And so the Work Ed Health technical assistance that we will be offering to the employers that you all train is a little bit different than the technical assistance you all received when you were participating in the program. But there are some similarities. And for Work Ed Health in general, technical assistance is the natural extension of the training program. It is a piece of the training program. For the employer participants, we really try to implement the principles that they learned during training to help them enhance or establish their worksite wellness program. So all of the things that you all went over with them during the 8 modules, 8-hour training day last year, we want to try to put in place so that they can implement a worksite wellness program. And for Work Ed Health, our technical assistance is based on 2 components: the structured TA, which includes the scheduled and planned webinars, any Q&A sessions, all of the archived worksite wellness resources that we used last year that are available both at the CDC Work Ed Health website, as well as the Work Ed Health Training and Technical Assistance portal. And then the second component is really organic technical assistance. So that we call our peer or self-initiated events such as meetups, unscheduled Q&A sessions, conference calls, and virtual meetings, and it's really based on the needs of the participants. So if Employer X has a need to understand budgeting for worksite wellness programs, they can get in touch with their technical assistance provider and schedule a session that is sort of off the cuff and really focused on that particular need. Our structured events really supplement the training programs and include information that possibly we couldn't fit into those 8 modules, but really help to bolster that information and provide extra resources. And so many of those that we've had currently in the current technical assistance program are about what to expect and how to use the new training and technical assistance portal. So want to be able to supplement the things that you taught them in training as a T3 with information that they need to get through the program now. for the employers, and I mentioned this person earlier in my statement, so for the employers, we want them to have a close relationship with their technical assistance provider. And for many of you, because you have a close relationship with them, with the employers that you train, you may have been in contact with them over the intervening months, really helping them, providing them with assistance. Well, now they get more assistance. They will, any employers that are participating in Work at Health will get a technical assistance provider assigned to them. And these are subject matter experts, many of them with years of experience in worksite wellness, and they will provide the employers with guidance and consultation and coaching throughout the technical assistance period. And this is a resource that is at no cost to the employer participant. And we've tried to put some numbers to it, and if an employer were to go out and hire a consultant to provide this level of hands-on support, it may cost upwards of $2,000. And so we really feel like this is a benefit to have this technical assistance provider be really a resource at hand at a moment's notice. You can email them, message them inside of our portal, call them in many cases, and get that one-on-one consultation. And these technical assistance providers really, when we select them and train them, are really focused on being responsive to the needs of our program participants and really providing them with timely and appropriate advice. So for us, this is what technical assistance is. Different from the T3 technical assistance, there are 4 milestones, and we would, they would work through all of them. There's an assessment, planning, implementation, and evaluation milestones that we would work through, that the technical assistance provider would help the employer work through during that first milestone. During assessment, they'll do things like the CDC Worksite Health Scorecard, a needs assessment for their organization, all of it really geared towards identifying gaps. Where are there areas that a worksite wellness program could focus on and close gaps, and eventually, as our goal, impacts the health of their workplace. During the planning phase, they would create a plan to close those gaps, determine what programs need to be implemented, how those would be done, and any needs that would have to be met, such as materials or scheduling or calendars. And then the third milestone is implementation. So this is where I like to say where the rubber meets the road, where they have to, now that they've identified the gaps and have a plan, they have to implement that plan. And the technical assistance provider will provide coaching and feedback, help them really figure out how, if they run into issues or obstacles or challenges, how to overcome those and work through it so that they can implement a program. Now, our fourth milestone is evaluation, and oftentimes, because it's the fourth milestone, people tend to believe that they have to wait until implementation is over to evaluate the program, but we really encourage folks to begin evaluating, process evaluating, looking at participation rates, looking at how much people like the programs that have been implemented, so that you can, in the next program, learn from that. So that's how we really, really work people through getting our program up and started. And when we say program, we mean a singular little p program, not a comprehensive worksite wellness program, handling all gaps identified in the scorecard or the needs assessment. We are, CDC sponsors this program, and so we have to make sure that we get progress reports in, and so we do ask that progress reports are submitted at the end of each of those milestones. But that reporting really helps CDC know that the programs that are being implemented work, and help us be able to track success and where we need to make changes, as we always are continuously trying to improve the program. So that was a long-winded answer of saying what technical assistance is, but I wanted to really provide our T3 participants trainers with an idea of what this side of technical assistance really looks like for their employers.
Certainly, and I'm sure that our participants on the line today are having a lot of positive flashbacks, and a lot of the languages are very familiar to them from their experience as T3 trainers. So they have delivered the training, their participants experienced the training, but how will the technical assistance affect employers' ability to implement a health and wellness program?
So the technical assistance that Work at Health provides in this phase is designed to provide employers with help to implement. So when you asked me the previous question, I said the implementation period is really where the rubber meets the road, and we really want to provide lockstep, step-for-step guidance for these employers on how to implement the program. We know that many participants are passionate about worksite wellness, but very few of us and very few of the companies that we work for have time to devote solely to that enterprise. So we have to make our business go and at the same time want to implement these programs. And we feel like here with the technical assistance that we help provide, we give you the ability to tap into the expertise of a technical assistance provider, as well as providing you with resources on various topics during the webinars or structured sessions. And these, as I said again, these technical assistance providers have their own level of expertise. So we're hoping that the information that we provide the employers can help them bolster their worksite wellness program, and of course, as our ultimate goal, improve the health of the workforce. So we want them to be able to really implement programs, and we feel like the resources, instead of an employer having to go out and look for various resources, we provide those hopefully in an easy-to-reach way with responsive experts so that employers can implement these programs. In addition, we want to help, the technical assistance providers can help strategize with employers about how to meet their worksite wellness goals. So, for example, if you're an organization, if your employer has an organization where the management is just not supportive, there's backlash for worksite wellness programs, the resources that we have available and the TAPs, the technical assistance providers, can really provide you information, provide the employers with information about what improving the health of your workforce does for your company's bottom line. And that is a persuasive argument. I heard recently had a TAP really say that she couches worksite wellness as a business growth opportunity, and I think that that's really a persuasive argument that people feel that they can grow their business, can improve their bottom line by having a healthier workforce. And those are the things that we really want to help employers with. And, always, having 2 or 3 or having a cohort of folks really think about your programs that you're trying to implement. Say you're in the pencil making business and someone in your cohort is in the eraser making business, you might have similar problems and similar issues and be able to help each other work through them, or have a totally different way of looking at how to implement a program in that environment. So we always say that being a part of the community, being able to access a multitude of industries and people with different outlooks and business models really provides our employers with ideas that they maybe have never thought of before. So that's what we're hoping that technical assistance provides for employers.
Okay, excellent, excellent. So we are ultimately going to be inviting people, the employers that were trained to participate. So when does the technical assistance begin? And for that matter, how long does it take?
Oh, great. Those are great questions. I'll see. You asked me 2 questions at once. I'll see if I can try to get them answered.
Well, keep on your toes, Nikki.
Technical assistance. So we have a cohort that started on May 1, but we don't want employers to be discouraged by that. We have another cohort that is eligible to start in August, starting on August 1. And so we really want to encourage our T3 participants to really encourage their employers that they trained, if they have an interest, to really start thinking about participating in the group that's starting on August 1st. Now, technical assistance, we're calling the technical assistance for these employers, lasts for 4 months. So each of the milestones, as I mentioned before, assessment, planning, implementation, and evaluation, each lasts about a month, 30 days or so. And so the cohort that will start August 1 will end on November 30th. So 4 full months of technical assistance. And in that time, we really want to provide the employers with a plan to get a small program started to jumpstart what we hope will be comprehensive worksite wellness programs in the future.
Okay, so that's great. And so it sounds like the employers will have, they've already received great training from the T3 participants that are on the line today. They're going to have access to this wonderful technical assistance opportunity. Will the employer participants get any type of certificate for participating?
That's a great question. Everybody needs a carrot. So we will provide a certificate which really will mark that organization as a Work It Health employer. And we really feel like that is, you know, CDC has sponsored this program, put a lot of resources and emphasis behind this program. It is a model going forward for worksite wellness, and so we really feel like organizations can use that to recruit good talent, improve the health of their current workforce, and really use the resources and their connection to Work It Health to improve worksite wellness going forward. So while it is a small piece, as we say, program, we really want this to jumpstart more comprehensive worksite wellness programs. And if I say it once, I'll probably say it 100 times, really with the outcome or goal of improving the health of your workforce. So we want to, you'll have a certificate, but you'll also be well on the way, the employers will be well on the way to making strides to improve the health of their workforce.
So why offer it to them? Why offer, you know, all of these, so it's at no cost, so you've talked about that. You've talked about what happens during technical assistance, talked about a lot of the benefits. So, you know, why do we want to offer it to them?
I think we wanted to talk to this group today because we know that the relationship between the train-the-trainer participants, all of these folks on the line, and the employers that they train is one that is the closest. And I think the train-the-trainer participants have a unique perspective because all of them had to complete both the employer core modules as well as their own T3 modules, so they really know the program and have all, you know, completed all of the requirements. And we really want to extend that, the work that you all started with your employers by having a greater connection to the Work It Health program. And so we wanted to discuss with the train-the-trainer participants today how we want to extend that, help that relationship be even closer, both extending the connection to the Work It Health program, but also providing more resources, more expertise, and really trying to help. What I know many of T3s have been doing is really keeping in contact with the employers that they trained, and so we want to really enhance that as much as possible.
So as a train-the-trainer participant, so what are some of the things we're really asking them to do to help their employers sort of get in touch and access, you know, this Work It Health technical assistance opportunity? What can they do now?
So here's my plea. So as soon as you get off the phone with me today and Hugh today, you know, connect with your the 5 or so employers that you trained. Many of you trained more than 5, thank you. And really discuss with them their needs going forward. Really discuss with them the pros for participating in the Work It Health program and receiving this technical assistance, and really ask them to think about participating and then stop thinking and do, and go and apply to participate in this next cohort that's starting in August. And we'll supply each of you with the link for that application, but really we want you to reach out to these folks if you haven't. Many of you continue to stay in contact with these folks, but really reach out to them, encourage them to participate in Work at Health, and, you know, tout the benefits. Many of you have seen the benefits for the worksite wellness programs that you have helped influence, and we really want you to pass that message along to the employers that you train and encourage them to apply so that they can reap the benefits and implement a program and begin working on a comprehensive worksite wellness program for their own organization to improve the health of their workforce. Again, I'll say it 100 times, that's our ultimate goal, and we really want the training that you all did, the great training that you all did last summer and fall and partially into the winter, to not end at that training, but really continue on through the technical assistance and make an impact in these communities, many of which are your own communities. So many of you are close to those folks that you trained in your neighborhoods, places where you shop or you do business as well, and so that will have an impact on you as well, and we want to see that impact grow as folks participate in the technical assistance and continue to have a connection with Work at Health.
Okay, so this is great. And so for those of you participating on the line, part of this is an ask for, as a former, or really as a trainer participant, that you reach out to those that you trained and help them understand the value of the technical assistance and encourage them to get engaged. And so that's the value for the people they trained, but we certainly wouldn't want to ask our trainer participants to go through these efforts without being able to offer them something as well. In some of the time we have left, can you talk about how the trainer participants can continue to participate in Work at Health and be involved with the employers and train the employers in their own communities?
I would love to, and this is a part of that we're very excited about. So many of you who trained, again, I say last summer through like July through December, so thank you all for spreading it out, have, you know, contacted Work at Health and really talked about what the next steps are. And so want to let you know, have this opportunity to discuss with you all that we are working on an agreement with you all to have continued access to the materials that are consistent with Work at Health. Oftentimes we are, you know, always continuously improving. There have been changes to the Work at Health curricula, things that we think could improve the Work at Health process, and we want you to stay involved in that. And so in the short little while, we will have a licensing agreement available to you so that you will be able to be listed in the Work at Health portal, and I will show you that really quickly as a certified trainer. And we want you to be able to use that information to train other folks. And so we'll ask that you complete the agreement, and then you'll be listed on the Work at Health portal. And I'm actually stumbling just a little bit so that I can show you the portal. And so here it is. It's a beautiful new portal, and I think you can see it, yes. And here we have a tab for certified trainers, and right now it does not contain any information. Slowly but surely it's coming. But we will have an information here, a list of those of you who are Work at Health certified trainers, so that you'll be able to be listed here. Your information, contact information will be listed here, so that when people want to use your services, they'll know where you are, where you're located, if it's in Louisiana or in Montana, where you are, and be able to connect with you and provide the training to other employers. The agreement includes having access to this portal as well as continued trainings and updates on the curricula, and so we're hoping to have that agreement in the next few weeks available to you all. I know I spoke to some train-the-trainer participants in the last week or so that are thinking about trainings later in the summer, and so want you to be on the lookout for this as well so that we can get you listed and get folks interested in your trainings and be able to spread the good word of Work It Health.
Okay, so that's excellent. So in addition to being able to provide information to the employers that they trained, those of us joining the call today, they'll also be able to take advantage of this licensing relationship and be able to train additional employers in their own communities. So, Nikki, thank you for that. We do have time for a few questions, and so I think we've all been so excited about the information that I did not continue to remind folks if you wanted to use your Q&A, your question and answer panel on the right side of your screen to type in a question, please feel free. And I'll give a pause or two for any of you who want to get your questions in. And excellent. We have a question coming in now. So one of the questions is, how can I, as a former or as a trainer participant, stay connected to Work It Health, and can the portal assist me in doing that?
That's a great question, and the portal, which I just showed, is the way to stay connected, as well as visiting the website on a regular basis. Many of the opportunities that are upcoming, ways that folks can apply for different opportunities inside of Work It Health are available there on the website, and that website is workathealth.us. And we want people to visit that. That's where you would go to find updates about Work It Health, stay connected. We have, we know who all of you are. If your information changes, if you change jobs, if you change your last name, things like that, please make sure that you contact myself or Work It Health Customer Service so that we have the latest contact information for you so that we can get information to you out, such as webinar, information sessions today. Many of those, some of those bounce back to us because folks had changed jobs, that kind of thing. So that's the way to stay connected and really follow us using workathealth.us.
Okay. That's great. Thank you, Nikki. We have another question that has come in. Are we able to go ahead with our previous materials to do employer trainings now? Do we send the list of those trained to CDC?
So those materials, we would have to probably discuss that with the T3 participant that asked that question directly. There have been some changes, some improvements to those materials. And I would say before you go train, let's talk about those materials that you currently have. They are, as far as I know, not reproducible. And so we'll need to talk about what materials you have and what references those have, because many things about the curriculum have changed and made it easier. We would ask that you send any trainings that you have done or are currently planning to do to us here at Work It Health using the information that's on your screen now, so that we have an up-to-date listing of how far Work It Health has reached out into your communities. So please send that information directly to us here at Work It Health Customer Service.
Okay, and I believe that is all the time that we have for questions. I want to thank you again, Nikki, for sharing your time and expertise. And special appreciation to our audience for participating. We value your feedback and appreciate you responding to the rating poll that appears on the right side of your screen. There it is. If you have questions or comments about today's session, please contact us using the information on your screen. Again, thank you for joining us for this exciting session, and this concludes today's webinar.